It's just gone 7 o'clock. Good morning, watching BBC Breakfast, and we have some breaking news for you this morning because in the last few minutes we've heard that the first coronavirus vaccine has been approved for use in the UK by the Medicines and Healthcare Products Regulatory Agency.
MHRA, as you may know. Now, this has been manufactured by the US pharmaceutical company Pfizer and its partner BioNTech. Data released last month showed that this vaccine is 95% effective. This is after the trial. So let's put this into context, shall we?
Yeah. The UK, if you remember, has 10 million doses available by the end of the year. Now, that is enough to vaccinate 5 million people. There are another 30 million ordered as well, which the hope was, you might remember the Health Secretary, Matt Hancock, telling us when he was live on the day that it was first announced, will come at some stage next year. And reports suggest vaccinations will begin in the next few days.
Now, a reminder, we are going to be talking to Matt Hancock, the Health Secretary, at 7:30. Of course, we'll get his reaction to this. And to put this in context, let's talk to our health editor, Hugh Pym, now. Now, Hugh, to put this in context, you know, when Pfizer first said it had the vaccine, we saw the markets absolutely soar, didn't we? I mean, the whole world has been looking for not just when a vaccine is produced, but when it's ready. And this is what this tangible information is telling us now. So what do we know in terms of when we can get it?
Well, it has just broken the news, literally in the last few minutes, that the Pfizer-BioNTech vaccine, which, as you said, they published trial results at the beginning of November, which were very exciting, 90% effectiveness. This is the key next step, getting approved by the British regulator, the MHRA, for use, emergency use, if you like. Now, that paves the way for it to be distributed as quickly as possible around, initially, the NHS in the UK, because the government has now got the green light to get it out there. So it's a very, very significant and exciting moment. The MHRA is the first regulator in any leading industrialised economy to give it the all clear. The European regulator, the EMA, hasn't started looking at it, will do very soon, nor has the American regulator. So it means within days, possibly early next week, hospitals will get the first doses and be able to provide them, to administer them to staff initially, we understand, and then others after that. So a really important moment, this, and we're going to learn over the next few days how it's going to be rolled out.
Now, we understand, Hugh, that we need to think about this in context, don't we, in terms of actually rolling it out. So the expectation is next week the vaccine is going to be made available. Is the NHS equipped to do that? And we already understood, didn't we, who would be getting the vaccine, first of all, it being frontline workers and those most vulnerable, I think over the age of 85.
Well, the initial plan from the JCVI, the expert committee covering vaccines, was that care home residents and staff would be the top priority, followed by health and care staff, followed by the over 80s. But because of the nature of this vaccine, remember, it has to be stored at minus 80 degrees. It's quite difficult to get around. Hospitals are, certainly in England, as far as we know, going to be the first recipients to distribute to staff, to vaccinate staff, because they can store it more easily. Now, we wait to hear more details of that, but hospitals have been told to be ready. They've been preparing for the last few weeks, getting ready to receive doses, and it could actually be early next week. But we'll need to wait to hear from the government about how they deal with this priority order. Remember that the AstraZeneca-Oxford vaccine is the one where far more doses have been ordered by the UK government. It seems likely that is going to be more appropriate for GP hubs and other vaccination hubs covering the at-risk groups that I've just said, and that is still going through the approval process. But as I say, we await to hear more details, but it seems to be a really important moment, paving the way for a green light for this to be put out there next week, and the first British people to receive the vaccine.
Do we have an idea of the numbers of vaccines that we'll be getting, Hugh?
Well, it seems, I mean, there was 10 million doses ordered from Pfizer, a certain amount before Christmas, but we're not sure. It's manufactured in Belgium, so it'll have to be transported over here. That could take a few days.
Hugh,
but,
quickly,
it'll be a certain amount, and I'm going to have to go very shortly, Naga. I'm sorry.
OK, I'll let you go, Hugh. Hugh, thanks very much. As our health editor, thanks very much. He's going to be covering all the channels, keeping us all updated.
Let me just read you this from the Health Secretary, Matt Hancock. He has been tweeting this morning. He's also going to be live on this programme in about 20 minutes' time. He says help is on its way. The MHRA, as we've been hearing, has formally authorised the Pfizer BioNTech vaccine for COVID-19. As Hugh has been telling us, and verified by Matt Hancock, he says the NHS stands ready to start vaccinating early next week. The UK is the first country in the world to have a clinically approved vaccine for supply. That's the Health Secretary. Like I say, he's going to be here live with us on Breakfast to answer all those questions and give us a bit more detail about how much and when, and that'll be coming at 7:30 this morning.
So just to recap, Pfizer and BioNTech joint venture, their vaccination has been approved by the MHRA, which is the UK regulator. We know that a total of 40 million doses have been ordered by the UK. We're waiting to get the exact numbers as to how many will be delivered or will arrive. Hugh Pym, our health editor, made very clear as well the point that this needs to be stored at -80 degrees. So we need to talk about the infrastructure, whether the hospitals and GP surgeries have that infrastructure, and also to get some clarification as to exactly who will be vaccinated first. The expectation is that next week people could begin being vaccinated.
Actually, we've just been told by NHS England, Breakfast has had it confirmed that it will happen next week. So they're ready to go next week with that vaccination from Pfizer and BioNTech. That is the main news of the day. Let's get a bit more detail from our political correspondent, Ian Watson, who joins us live from Westminster. Ian, it's one of those times where there's lots of stories around at the moment, but this is the one that's going to dominate the headlines, isn't it?
It is going to dominate the headlines. People have been waiting for a game changer for a long time. And now that we have at least one vaccination being authorised for use, then the hope is, of course, that others will be approved soon afterwards. Certainly, as far as Pfizer is concerned, the government's ordered 40 million doses of this. They've said themselves it will take a while to roll out, but they always had hoped to try to get vaccinations started before the end of the year. We now know they will be started next week. 40 million doses represents 20 million people in total, because people need doses a couple of weeks apart. So again, it will take time to build up its effectiveness. Given that that is the case, though, I think it's important politically as well as medically, because we saw the restlessness in the House of Commons amongst Boris Johnson's own MPs yesterday. Some people saying we may have to live with this virus for a long time, and quite frankly, you know, the economy, the hospitality industry and so on simply cannot sustain that unless the government rethinks its restrictions. The government will now be able to say, look, for goodness sake, hang on, be patient. As Boris Johnson says time and again, the cavalry is on its way in the form of a vaccine. So we would hope that people would say, actually, let's put up with perhaps further restrictions, more restrictions we would like in the short term, as long as we can see an escape route from the virus beyond that. And this is, I think, at least the hatch has been opened, if you like. One of the vaccines, of course, has been approved for use. But I think, as Hugh Pym, our health editor, was saying, though, are reminding us, this vaccine has to be stored at something like -80 degrees. So the Oxford vaccine, the AstraZeneca vaccine, is something which could be stored in the fridge. So it could get out and around to people. We've got many more doses of that on order. If it gets approved, then perhaps that would be the game changer we want. But certainly, if people are looking for a light at the end of the tunnel, then a big, gigantic, shining torch has appeared in the form of the approval of the AstraZeneca, of the Pfizer vaccine.
Ian, thank you very much for that. I know that people are tuning in all the time at the moment, so we should probably retell the main story this morning.
Absolutely. So what we have heard in the last 11, 12 minutes is that the joint venture between Pfizer and BioNTech, now, they've been working together to get a vaccine for coronavirus, to tackle coronavirus. We knew from the trials, which we found out in November, that the vaccine is 95% effective. Now, the UK has become the first country to approve a COVID-19 vaccine following these large-scale trials. The regulator, the MHRA, has said it can be authorised for emergency use. Now what we understand is that the UK has ordered 40 million doses. Remember, this is a 2-dose per person vaccine. It has that on order. This vaccination was submitted for approval as well with the EMA on Monday, but it's the MHRA has approved it. So the UK now the first country to approve a vaccine for COVID-19.
We don't know yet how many will arrive next week and be available to use. We'll ask the Health Secretary, Matt Hancock, about that. And obviously, we're still awaiting news on the Moderna vaccine.
Indeed, and that was submitted for approval with the EMA, the European EMA, the European body, the equivalent of the MHRA. That was on Tuesday as well. So we're waiting on that, but this is the MHRA UK approval. We also understand, just for some background, there was a lot spoken about how this vaccine works and how it will be stored. This is the one that needs to be stored at -80 degrees. So there are going to be questions which you will put to the Health Secretary. Where can it be stored? How easily will it be able to be rolled out? And we are being told NHS England is ready to roll it out.
But, yeah, we've spoken to them this morning. They've confirmed they're ready to go next week.
Next week. So lots to talk about. All of that, good news. Of course, we'll see the reaction in the markets later as well, but we're going to keep you updated.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.